So this was looking at all the data that we've collected on the patients that were treated on the NHS since the inception of the programme to deliver licensed CAR T-cell therapy for ALL. And so we've collected all the data on all the patients up to the summer of this year and then followed them up to October. And we've really uniquely been able to do a few things with this data set. So firstly, we are able to systematically capture all patients going through the system as long as they've been deemed eligible for the treatment. And that means that we're able to truly deliver outcomes on the basis of an intention to treat. And so those numbers are really important for clinicians when they are sitting down for the first time with the family and they want to explain how feasible it is, how safe it is, and what the likely outcomes are longer term. So that's great to have that data. In addition, we analysed it using two different event definitions. In the Eliana study, they used a particular event definition where patients going on to have further therapy were censored, and so it doesn't capture those patients who had to have another treatment without a relapse actually being the cause. But we also then analysed by a very stringent event-free definition where we include all clinically relevant events, including those patients that have to go on for further treatment, either because of loss of CAR T-cells at an early time point or because of the emergence of measurable residual disease. So they don't count as a formal relapse, but they still need to go on to have further therapy, and they're very likely to relapse if they don't get further therapy. So those patients, rather than being lost in terms of an event definition, are captured in our stringent event definition. So again, in terms of data for clinicians who are advising and guiding patients, those sorts of data are really important. Not just that, one other thing that's unique about our data set is that we've been able to totally capture the outcomes of patients, including those that failed CAR T-cell therapy for any of those different reasons, and then go on to have further treatments and understand what their outcomes are after that. So we can now talk about how many patients were salvaged back into a molecular deep remission and how many were for example, had toxicity from that next treatment that they had in terms of therapy-related mortality. So these data are really, really important in the field. And in the UK with NHS delivery, we're able to really get all that data together, and that is unique across other real-world cohorts.